Hello, everyone. So, next I'm going to read another section in chapter 2 that I've been studying. I'm going to talk about mental health disorder. So, mental health in healthcare. So, mental health disorder is a normal function of emotional and intellectual abilities. A person who is mentally healthy is able to get along with others, adapt to change, care for himself and others, give and accept love, deal with situations that cause anxiety, disappointment, and frustration, take responsibility for decisions, feelings, and actions, control and fulfill desires and impulses appropriately. The ability to interact with other people is a characteristic of mental health. Although it involves emotions and mental functions. A mental health disorder is like a physical disorder in many ways. It may have physical causes such as differences in a person's brain structure or the way the brain works. It produces silent symptoms and affects the body's ability into its functions. It responds to proper treatment and care. A mental health disorder disrupts a person's ability to function in a family, home, or community. It often causes inappropriate behavior. Some signs symptoms of mental health disorders are confusion, disorientation, agitation, and anxiety. People who have a mental health disorder can not simply choose to be well. Um, People who are mentally healthy are usually able to control their emotions and actions. People who have a mental health disorder may not have this control. Different types of mental health disorder affects how patients communicate. Nursing assistants should treat each patient as an individual to promote person-centered care. They should tailor their approach to the situation. Guidelines, communication, and mental health disorders. Do not talk to adults as if they were children. Use simple, clear statements and to normal tone of voice. Be sure that what you say and how you say it should respect and concern. Sit and stand at a normal distance from a patient. Be aware of your body language. Be honest and direct with any patient. Avoid arguments. Maintain eye contact and listen carefully. Maintain eye contact and sit in normal distance when communicating with patients. And of course, we'll talk more about it in chapter 9. Okay, next we're going to talk about combative behavior. Patients may display combative, meaning violent or hostile behavior. Such behavior may include hitting, pushing, kicking, or verbal attacks. It may result of a disease affecting the brain. It may be due to frustration or may just come from someone's personality. In general, combative behavior is not a reaction or to a caregiver or a patient. Should not be taken personally. Nursing assistants should always report and document combative behavior. Even if the nursing assistant will not find the behavior upsetting, the care team needs to be aware of it. Guidelines to combative behavior. Okay, everyone, I'll continue that in the next video. Thank you, everyone. Bye-bye now. Okay, I'm back. So, guidelines to combative behavior. Block physical blows or step away from out of the way, but never hit back, no matter how much a resident hurts you or how angry or afraid you are. Never hit or threaten a patient. When dealing with combative residents, step out of the way and never hit back. Allow the patient time to calm down before the next interaction. Ensure the resident or patient is safe and give her space. Give him or her space. Ensure the resident is safe and give her space. When possible, stand at least an arm's length away closer to the hallway. Remain calm. Lower the tone of your voice. Be flexible and patient. Stay neutral. Do not respond to verbal attacks. Do not argue or accuse the patient of wrongdoing. If you must respond, say something. Like, I understand that you're angry and frustrated. How can I make things better? Do not use gestures that could frighten or startle the patient. Try to keep your hands open in front of you. Be reassuring and supportive. Consider that provoke the resident. Sometimes something as simple as change in caregiver routine can be upsetting to the resident. Get help to take the resident to a quieter place if needed. Report anything inappropriate behavior to the nurse. Anger. Anger is a neutral emotion that has many causes. These include disease, fear, pain, loneliness, and loss of independence. Anger may also be part of someone's personality. Some people get angry more easily than others. People express anger in many different ways. Some may shout, yell, threaten, throw things, or pace. Others may express this anger by withdrawing, being silent, and sulking. Sulking. Anger behavior should always be reported to the nurse. Stay calm, do not argue or respond to verbal attacks. Empathize with the patient. Try to understand what he or she is feeling. Try to find out what caused the patient to be angry. Listen attentively as the patient speaks. Remain silent. This may help the resident explain. Treat the patient with dignity and respect. Explain that you are explain what you're going to do and when you're going to do it. Answer call lights promptly. Stay in a safe place and distance if the patient becomes combative. Inappropriate behavior. All right. Inappropriate behavior from a patient includes trying to establish a personal rather than a professional relationship with the nursing assistant. Example includes asking personal questions, requesting visits or personal time, asking for or doing favors, giving tips or gifts, and lending or borrowing money. Inappropriate behavior also includes making sexual advances and comments. Sexual advancements include any sexual words, comment, or behavior that makes the person to whom it advances and are directly feeling comfortable. Inappropriate behavior may also include residents moving their clothes or touching themselves in public. Illness, dementia, confusion, or medication that may cause the behavior. Confused residents that may also have problems that mimic inappropriate sexual behavior. They may also have uncomfortable rash clothes that may be too tight or too hot, too scratchy, or they may need to go to the bathroom. Nursing assistants need to observe for these problems. Nursing assistants can also address for inappropriate behavior, directly saying that something like, that makes me uncomfortable. Appropriate responses to personal questions include, I can't really talk about my personal life on the job. If the nursing assistant encounters a resident in an embarrassing situation, she should remain professional and not overreact. Trying to distract the patient may help. If it doesn't, then the patient should not be taken to a private area. The nurse should be notified. When patients act inappropriately, nursing assistants should report the behavior even if they think that is harmless. Patients' rights. Communicating with patients. Nursing assistants' interactions with residents or with patients are important. Patients' physical, psychological health can depend on a great deal of how the nursing assistant communicates. This is especially true when patients who are cognitively impaired, lonely, helpless, or bored. Nursing assistants should be comforting and kind with patients. They should listen if the residents want to talk. Just the presence of a caring person to reassure the residents that they are not alone. For everyone, that's the end of section 3. I'll continue section 4 next time. Please comment and subscribe. Have a great day, everyone. Bye-bye now.